We believe that addressing social determinants of health is another way to ensure that our members receive the care they need. And many of these are met just through our partners here in Florida. Speaking of just the power of partnerships and to kind of level set and show context, um, almost half of the births here in Florida in 2021 were covered by Medicaid. And so this is why we rely so heavily on community partners and programs that help us support better health outcomes and birth outcomes for our moms and babies. One of our highlighted partnerships is with the Indian River County Healthy Start Coalition, where we partner to recruit and train doulas across Florida that will help provide support for pregnancy, births, and post-deliveries we have here in Florida. The Grow Doula model addresses the needs to build a diverse doula workforce by working with many of our Healthy Start coalitions across the state and giving doulas the administrative support needed to build a business, but also create a community of support. Another initiative we have that speaks to the disparities within Florida's communities is with ACS, the American Cancer Society. It is a breast cancer screening learning collaborative that's focused on increasing screening rates. This partnership is with 4 of our locally federally qualified health centers. And this partnership addressed top barriers that include transportation, financial and lack of health insurance, as well as lack of education about the importance of these screenings. When we look at implicit biases within healthcare, we've partnered with March of Dimes on an implicit bias training to mitigate biases within maternal and infant healthcare. This training is offered to healthcare professionals and promote better outcomes for our pregnant and postpartum individuals, our newborns and families, no matter their identity with this training. Now, when we look at cultural competency care, it's defined as care that respects diversity and cultural factors that can affect health and healthcare, such as language, communication, styles, beliefs, attitudes, as well as behaviors. Reducing health disparities and achieving optimal healthcare goals remains important to Sunshine Health. Engaging our employees is definitely a fundamental piece of reducing those health disparities through culturally sensitive and unbiased quality care. It is very critical to our mission here at Sunshine to bridge those gaps and alleviate challenges for our members to allow them to focus on their health and the health of their families. We feel here at Sunshine Health that in order to best serve our members, it's important for us to equip our employees with the tools they need to deliver that care, that level of care with cultural awareness. And so here at Sunshine, we offer annually our cultural humility training. We have various employment engagement groups, such as our Mosaic and Inspire, that speaks to communities and educating our employees on various communities and backgrounds. Health equity training, we also provide SDOH awareness, as well as throughout the year, there are many employment education activities, such as webinars. Now with SDOH, I think you guys have heard me talk about that a couple times, but social determinants of health are conditions in the environment where people are born, live, learn, work, play, worship, and age that have a direct impact on a wide range of health, functioning, and quality of life outcomes and risks. And that definition is found on health.gov. And so SDOH is categorized in 5 different ways: healthcare access and quality, education access and quality, economic stability, neighborhoods and environments, social and community context. Now, here at Sunshine Health, we are helping Floridians overcome those barriers, those SDOH barriers, by offering our community connections teams. We have support contacts through a community source database, but also a hotline where our members are able to reach out to to us directly, or any of our 600 partners to access food assistance, housing and utility assistance, financial help, education and training, as well as support groups. We've awarded community connection grants annually within the state, as well as provide additional support to those organizations and our members through expanded benefits. We also offer a food pantry in a partnership with Farm Share. We have opened up food pantries throughout the state of Florida. Ocala was one of our first health food pantries. We have them in Orlando, Jacksonville, Lauderhill, Tallahassee, as of this week, Tampa, as well as Miami. And these food pantries are serviced and supported through our employee volunteer hours, where we so far have over 16,000 hours as an organization supporting the needs of our community. These food pantries are open once a month, and not only to our members, but also to the communities in which our welcome rooms sit. When we look at just the importance of workforce development in answering healthcare outcomes, we have our program that we've titled Sunshine Health Works. It is a work development program that's designed to provide career opportunities for the community, as well as bridge those care gaps caused by the various labor shortages that we see in healthcare. And so we've partnered with many of our local colleges: Tallahassee Community College, Broward College, Hillsborough Community College, and FSCJ, United Home Healthcare, and as I mentioned earlier, with Grow Doula. These programs are within 8 counties across Florida and continue to expand. We have members as well as community members receive certification within various healthcare professions. And again, we have over currently 550 people who have been served since the inception of this program in 2020. We have 11 welcome rooms throughout the state where they serve as a community resource and gathering place for folks to connect here in Florida to social services, health and wellness classes, support groups. There are health fairs provided in this room, baby showers as well. Sunshine truly believes in being that active member in the communities that they serve by focusing on helping those who are most vulnerable get the access to care that they need as well as they deserve. And so these rooms are open to community organizations as well as many of our members if there are meetups or tutoring or anything that they may need or they see fit as a meeting place or gathering place. As I mentioned earlier, the community connections grants that we provide. So far, just in 2024, we've provided over $200,000 in grants to address social and environmental factors that impact health outcomes of our members within the 11 Medicaid regions. Applications for our next grant cycle are open as of this week, actually, for housing programs. So Florida nonprofits that support housing programs and prevent homelessness can apply for a grant up to $10,000. For more information, Sunshine, if you go to our sunshinehealth.com website and go to the newsroom link, you'll be able to find more information on those community grants. Just to spotlight as I close, one of our Healthy Start partnerships. Again, with Healthy Start, they are entrenched in many of the communities around the state to help with parenting and birth outcomes. And so our partnerships have included donations of supplies, baby showers. It's allowed many of our members to attend these events to learn about vaccine programs, but also resources to help with the structure and education of their family. Sunshine Health also conducts monthly case conferences with the Healthy Start as they refer members to their program to further maximize our touch points with members within our communities. And I guess at this time, I will give it back to you, Greg, in case you want to provide questions at the end of all of the presentations.
Yeah, I think we're going to ask folks to include questions in the chat, and we'll be circling back at the end of each of this. I mean, at the end of the three presentations. So thank you for sharing that, Kamia, and all your insights on this topic and the good work that Sunshine Health is doing in the community. And now we're going to turn our attention to ask Lisa Hamilton. Dr. Lisa Hamilton is up next to present. Again, Lisa's with the Florida Community Health Workers Coalition. So Lisa. I think you're on mute there, Lisa.
Yes, I'm just talking and I was here. Well, thank you, Greg. And thank you, Ms. Brown, one of those proud partners of Sunshine Health. And so we thank you guys for all that you do. I'm just going to talk about a little bit about the CHW role in providing culturally competent care to diverse populations. I won't keep you long. Slides are not moving. Not moving. Okay, I guess I'll just stay here and talk a little bit. A little bit about the Florida Community Health Workers Coalition. We are the recognized leader and the professional home of about 880 community health workers in the state of Florida. Our mission is to promote and advocate on behalf of the community health worker profession, but also those individuals and families, those underrepresented and unserved groups impacted by health disparities. We do this again through our multi-sector partnership, which consists of about 300 organizations to date. We also do this through training, advocacy, and leadership. And I often get this question, what is a community health worker? Well, we follow the recommended description by the American Public Health Association, which states that ACHW is a frontline public health worker who is trusted, in their community and they have an understanding of that community, that trusting relationship enables the CHW to serve as a link between the communities and health sectors. CHWs are called by many names: promotoras, lay health workers, peer educator, uh, community connectors, health navigators, community health advocates, peer support specialists, outreach workers, and there are about 600 other titles that CHWs are classified under. And so, in this role as a community health worker, uh, CHWs are vital to ensuring the cultural competency of care in the community. They do this through health education and a lot of outreach in those diverse communities. They bridge the gap, sometimes uh, in communication between social service sectors as well as between doctors. They also address those social uh, needs of the community, like connecting them to programs like the one Ms. Brown described earlier. Uh, they serve as sometimes interpreters for individuals and families who may speak other languages. And so, because of this unique understanding they have with the populations they serve, the most important part of it is that built trust. And I think we heard our opening presenter this morning talk about it's a matter of trust, right? When uh, those health professionals are trying to connect with the patient. CHWs have this built trust, mainly because, for one, most CHWs can relate, have those same lived experience with the members that they're serving. They come from the diverse backgrounds of some of the same people that they serve. And also, one of the things that I've noticed more so since COVID is a sensitivity that we sometimes as professionals who work from our office spaces, um, they've developed a sensitivity that helps them to connect at a different uh, level than talking to someone on the phone or talking to someone through a computer and sometimes from behind a desk. And so we believe at the Florida Community Health Workers Coalition that when a patient understands their health information, they can actively participate in their care. And so, some strategies that CHWs use in providing this care in these communities is sometimes done through research. It's done through some of the trainings that they receive. And some of those strategies come directly from the communities that they serve, because the communities will tell you what they feel is appropriate, what they don't like. They will tell you that I prefer this or I prefer that. So, a lot of the strategies used in providing this competent care that we're discussing today comes from mechanisms and sources such as that. CHWs have very active listening skills. They truly understand the patient's perspectives. Um, they also, again, respect and can appreciate those cultural norms and beliefs of those diverse populations that they're serving. And lastly, and which I feel is often not emphasized enough, because we also teach self-sufficiency, right? We want a patient or a client to be able to advocate for themselves, but there must be a level of empathy that is demonstrated when caring for these diverse populations. And also, so we as health professionals and community members, um, being able to uh, relate to what a client or patient is experiencing at that moment is so vital to the work that we do every day. And so, in conclusion, I think some of the lessons that we have learned over the years is as our populations become more diverse, the understanding of those cultural nuances will become critical. But the other element that we find that is going to be really important in the work that we do is literacy, making sure that every tool that we use in our daily arsenal is adaptable to the community that you're trying to reach. And I think I heard some of our other speakers speak to this as well. And then also in ensuring equitable care. We feel that this reduces, um, uh, I'm sorry, improves the health outcomes of our people we're trying to reach. So fostering cultural competency and promoting literacy is essential, and CHWs have been doing it for more than 60 years, maybe under other titles, but it's essential uh, to the work that we do every day, uh, that compassionate, effective healthcare that we're all seeking to continue to do as we move forward in our day to day. And lastly, making sure that our communication strategies address literacy, the literacy challenges, but also close the gaps in the services that's being provided to these populations. Um, to date, the Florida Community Health Worker Coalition, um, providing direct services with only 4 CHWs, we have served about 1,400 individuals through programming, through health education. Again, we originally started out as a membership organization in October of, I believe, 2023. We started to provide direct services, and our CHWs are making a huge impact in the community. We are aware that they can do it. We always known theoretically that they can do it. Evidence is there that CHWs are effective in this role. But we finally put some boots on the ground ourselves, and we're very excited about some of the outcomes that we've experienced to date. And so I'm going to stop there, and I'm going to turn it back over to Greg. And thank you guys for giving me a few minutes just to share a little bit about community health workers.
Very good. Well, thank you, Dr. Hamilton. That was very informative, and it's great to hear the fantastic work that community health workers are doing throughout the state of Florida, helping to improve health outcomes and helping to provide more equitable care. It's frontline workers. They're where the rubber meets the road, and we appreciate all their good work. Next up, we have Dr. Merlene Ramnon, who is the program director of the Florida Department of Public Health in Palm Beach County. So, Merlene?
Yes, I'm going to share my screen just now. So let's see how I get that share. Oops, sorry. So where is? I think I lost. Not sharing. Okay. So let me share my screen one more time. I think I have it. Okay. Share. Can you guys see my screen?
Yep.
Okay, perfect. Good afternoon, everyone. My name is Merlene Ramnon, and I work for the Florida Department of Health here in Palm Beach County. So just to follow suit with Kamia and Lisa, I'm going to be talking a little bit about what we do here in Palm Beach County. Okay, so I wanted to give some.
I think you're on a black screen. Okay.
Black screen.
Okay, that's good. Somehow you went over to a different screen format.
Are you able to see my screen now?
Yeah, it says definitions of cultural competence. Is that what you want?
Yes,
Okay.
I may have to go that way because once I put it in the presentation mode, then it changes it. So I'm just going to go this way. Thank you.
Okay.
All right, so I have on the screen some definitions of cultural competency, and I know you guys are very familiar with a lot of these definitions, but just to look at some of the perspective of the authors. So we see it's loosely defined as the ability to understand, appreciate, and interact with people from cultures or belief systems that are different from our own. One of the author also talks about cultural competency. Psychologists still have very little knowledge of what constitutes good treatment for people of diverse cultures, and it's also one of the core competency in psychology. There's still controversy over the basic ingredients of what constitute cultural competency and cultural competent care. And there's also the idea that, we have to do cultural adaptations because when we are working with different groups, we want to modify those evidence-based treatments. We also want to incorporate a more individualized understanding of families and culture into some of those cultural competent intervention that we are providing to our clients. Move on into some of the factors that contribute to cultural competency. And so here we have an understanding that cultures must be considered, and we have to look at the historical, the social, the political, and those economic contexts. Benecor defined culture as a pattern of learned beliefs, values, and behavior that are shared within a group, and it includes language, styles of communication, practices, customs, and views on roles and relationship. And this morning we heard about our main speaker, Dr. Zygmunt Fisher, and his story of his experience with healthcare, how much I want to say he understood what the provider was saying as that medical person and having that background, that scientific education knowledge, but how many of our patients would be able to understand and read the table and understand how does that relate to me? So we have to look at these things in different contexts. Culture is also shared beliefs, values, and assumption of a group of people who learn from one another and teach to others that their behaviors, their attitudes, and their perspective are correct ways to think and to act and to feel. And in that cultural competency, we need to look at language, the literacy level. We also look at the provider who is communicating to the patient and also looking at the client, how well receive that information. We also want to look at implicit bias. And so when we talked about implicit bias, we are talking about those predetermined, unfounded, unreasonable feeling, judgment, tendency, or attitude against, individuals or group. We also want to look at the demographic information. What are some of those? We all know what those are: race, sex, gender, you name it. And so when we looked at B, implicit bias, there are different types of bias. And so bias can be, positive or negative, and it does prevent us from judging others fairly. So cultural intelligence, this behoves us to be cultural intelligent when we're seeing our clients, when we're working with others of different ethnicity, different background, different culture. The ability to interpret behavior, understand and respect one's culture, and cultures that are pretty much unfamiliar can also have some negative effects on a person's sense-making mechanism that determine their behavioral responses. So if we're not familiar with those cultures, we may end up having some, unwanted responses, to those individuals. What are some goals of developing cultural competency? So some of the goals are listed here: to understand, to communicate effectively, and interact with people across cultures. We also want to compare those different cultures with our own and better understand the differences. We need to look at our own unique history. Our personality does play an important role. And here are some attributes or characteristics or quality that helps us in developing cultural competency. We need self-knowledge and awareness of one's own culture. mentioned before, awareness of one's own cultural worldview and our attitude toward cultural differences. These are some strategies to enhance cultural competency. We have to practice openness and acceptance of differences. We also need to be flexible. And in being flexible, we have to accept acceptance of ambiguity. So this is one way that we wanted to make sure that we are reaching out, and there are more than one interpretation, there are more than one meetings that we can have with our clients. We also want to demonstrate humility and, suspension of those judgment and the ability to learn, be sensitive, appreciate other cultures and their differences. We also want to show spirit of adventure, show those curiosity and see opportunities in different situations, ability to laugh at ourselves. And also we wanted to practice positive change or action, which shows successful interaction with the identified culture. Some of the healthcare challenges that we often see, and health is determined by many factors outside the traditional healthcare setting. The factors are not limited to education nor quality housing, access to healthy foods. Some populations have unfavorable factors that contributes to lack of access to healthcare. Some groups are less likely to have access to reconstructive surgery. And there's also underrepresentation of culture, gender, and ethnic groups of leadership in some of our healthcare trainings. Here are some measures to improve cultural competency and to improve healthcare. We wanted to make sure we attract qualified persons who are representing the target population. We want to retain and promote those highly motivated and skilled staff. We want to have measures to educate staff and students at national conferences and also within our own organizations and institutions. We also want to have opportunities to improve cultural competency and healthcare issues that affects other groups by including all levels of staff. And as Nir and Aditayo mentioned, we want to have those personalized approaches to meet healthcare needs. Some of the things that we do here in our own agency at the Department of Health, Palm Beach County, we work with a lot of organizations. We work with American Heart Association. We work with our Diabetes Coalition. We work with healthcare districts. We work with Palm Health Foundation, County Health and Human Services. We work with schools and university, and we provide a wide variety of education and resources to groups. We go into all areas of the county. So we go from the northern to the southern, to the east and the west. And in the western community, if you're familiar with, some of those areas, Belglades, Pahokee, Canal Point, we provide services out there. It seems like it is so far away and remote from Palm Beach County, but it's one of those areas that is oftentimes forgotten. And so we do a lot of outreach events. We provide resources, as I mentioned before. We provide education, and we make sure that they're tailored to the individuals. We also have a number of health centers throughout the county. So we do have 7 health centers. We do have a refugee program. And that refugee program, we see clients from all walks of life. We provide languages, the 3 main languages, English, Spanish, Haitian, Creole, but we also have the language line to suit the clients that we serve. So we do see clients from all walks of life in all our clinics. The Refugee Health Center is separate from the other clinics, and that's designated strictly for refugee clients that come to Palm Beach County. In our other health centers, we do have, our HIV clinic, STD clinics, maternity clinics, tuberculosis clinic, epidemiology, and all the different programs. And we do see clients, all walks of life, speaking different languages. So it behoves us, how do we communicate? How do we treat our clients? And during the pandemic, I believe in 2020, In the early part of 2020, we did a survey on the clients that came to one of the largest health centers, and we followed the client as they walk into the clinic, as they appear at the kiosk and check in and then go to the registration desk, moving from there to the health support area where the vitals are done, to the nurse, to the provider, and leaving the clinic just to see how much the client understood each area, what was communicated to the client, and see their response. And we wanted to have a good idea. Did they miss something? Did they understood what the provider was saying to them? So we follow them through, and then we ask questions. So we had various staff members, medical doctors in our residency program following the clients with the different languages. And so we had a better understanding how many of the clients understood and what are some things that we needed to put in place so that we are providing and we understand the whole idea of cultural competency. You know, how much did the clients understood each provider? What are some of the gaps? So moving along, we also looked at different things in our clinics that we would be able to enhance the patient flow. And so clients is not just about the language, but also the wait time. And so wait time is also important for clients. You know, sometimes our clients have issues with transportation, and that's one of the things that we have to make sure we take into consideration. You know, transportation, providing access to care. And I know, you know, a couple of you talk about insurance and so on and so forth. And those are crucial in understanding and being aware of cultural competency. We also have staff members that support our patients. So we do have the minority health liaison, and those minority liaison are embedded in all 6 or 7 counties. That's a new initiative that was started, I believe, in 2020. So in all the county health departments, we do have a minority health liaison who goes out into the community, educate and provide resources for our clients. And I think I wanted to go back and look at this slide that I have on the screen, Agency for Healthcare Research and Quality. So just so that we're aware of the different things that we have within our nation. So the National Healthcare Quality and Disparity Report assesses the performance of our healthcare system and identify areas of strength and weaknesses, as well as differences for access to healthcare and quality of healthcare. And they look at these 6 priority areas, as you can see on the screen: patient safety, person-centered care, care coordination, effective treatment, healthy living, and care affordability. Within this agency, they also complete the annual National Healthcare Quality and Disparity Report, which is mandated by Congress. And that provides a comprehensive overview of the quality of healthcare received by the general US population and disparities in care experience by different racial and socioeconomic groups. So the importance of access to care. Access to healthcare means having the timely use of personal health services to achieve the best health outcomes. Access to comprehensive quality healthcare service is important for promoting and maintaining health and preventing and managing disease, reducing unnecessary disability and premature death, and also achieving health equity for all Americans. How do we attain good access to care? It means you have to have health insurance that facilitates entry into the healthcare system, timely access to needed care, that's a repetition, and usual source of care with whom the patient can develop a relationship, as well as the ability to receive care when there is a perceived need for care. Okay, I have included a data tool for the national and state quality measures. And this is a tool that you can actually access to see what is going on in your state as well as in the nation. And I'm just going to click on it just to give you, hopefully it works. Hopefully it works. Open link. I think it's, I guess it's not allowing me to open it. Open link, let's see. It's taking so, okay, so this is what it looks like. The National Healthcare Quality and Disparity Reports. I am so sorry it disappeared. For whatever reason it is. Okay, it's coming back. So here you can see, I'm going to just scroll down to give you pretty much a vivid imagination of what it looks like. So this is the national, this is the state data query special emphasis. If you click on state, this is what you're going to see. And so this is a snapshot summary that you can see the strongest and weakest with the data. You see all topics, you see race and ethnicity, you see income levels. This is kind of like set to Alabama. You can scroll down here and you can put in for Florida, whatever you want to look at. And then there is the subject area for all the measures. And it tells you those priority areas, access to care, disease and conditions, and so on and so forth. So this is a very good snapshot dashboard that is useful to see what is happening in your area. So I am going to see how do I get back
No,
to...
we're actually, Marlene, I don't think you ever left your presentation. We didn't see the website, so.
Oh, you were,
Yeah.
oh, you were able to see it.
I didn't.
I'll send it out to you so you can share it with the group. I'm not sure what is going on, but yes, I probably should have stopped share and then share again. However, I can send that to you and I can put that in the chat box. So I'll put that copy and put that in the chat box.
And we are kind of wrapping up our time.
Yes.
So yeah, thank you.
Okay, so these are two questions that I have for you, and you can put these questions in the chat box. So the first question is, what is your knowledge and cultural competency? And choose any of the answer below. Extremely knowledgeable, very knowledgeable, gain some amount of knowledge, little knowledge, no knowledge. The second question is, how equipped are you with the subject after participate in this summit? Extremely equipped, very equipped, somewhat equipped, little equipped, not equipped. So these are the two questions that I have for you. And these are some of my references, if you can see the slides. And this is the end of the presentation. Thank you very much. And that's my contact information on the screen. Thank you.
Very good. Thank you. Lots of good information. Appreciate it. Okay, so we'll open it up to questions now. We do have a few that have already been put in chat. So thank you, Linda. Asks, and I guess this one's directed to you, Kamia, is the ACS breast education program active in other states? And that,
Hi, yes. Well, the American Cancer Society program is an initiative in other states, but this particular initiative is one, or collaborative, that's only here in Florida with Sunshine Health.
okay. This one's, I believe, directed to you, Lisa, which is, what steps do you need to take to become a CHW?
So that question is often intertwined with what I need to become a certified CHW versus what I need to become a CHW. And so for clarification purposes, when we're looking at someone becoming or beginning training for CHWs, we look for certain attributes. You know, is the person resourceful, persistent, trustworthy? So these are qualities or attributes we look at in addition to training. When a person says, I want to become a CHW, we do offer those services. We try to encourage a organization to gather 10 or more people if possible, and we will organize a training for that team or those individuals to become CHWs. Now, if you're talking about, and I think the next question was about certification, an individual can become a certified CHW by having 500 hours of work experience, complete the core competency training, and must have at minimum a high school diploma, even though um, I'm kind of, on the line with that one because I have CHWs that have been working with migrant populations for 20 years and don't have a high school and are doing a phenomenal job reaching those populations and serving their needs. And so, but one of the requirements of through the Florida Certification Board is that the individual at minimum have a high school diploma. And so there's the training, the 20 hours of supervision, the 500 hours of work experience that an individual must have to become a certified community health workers. Every month, we offer what we call office hours from 12 to 1:30, where we go through what that process looks like. You can, and I think the next class is March 15th, but it will not show on our events calendar until tomorrow, I believe at 12 noon for next month. And so if you're interested in learning more about the certification process, I encourage you to check our website tomorrow. Go to March 15th, click on the link, register for office hours, and we'll be able to go more in depth on what that looks like step by step during that time.
Okay, very good. If you wouldn't mind putting your website
Sure.
in the chat. Yeah, somebody, Kelly was saying that they could put a group of 10 together and be interested in having a training if that's workable. I know you said that there were hundreds of titles that CHWs sort of fall under. Does that complicate things a little bit with regard
Oh,
to?
absolutely. Absolutely. In 2010, we met with the Department of Labor and went through this with them like at Vatum. And so they have begun, if you go to the BLS.gov website, maybe I can put it in, or I'll share it. And Greg, if you guys can send it out, you'll see that slowly they are beginning to add to the list because the word community health worker is an umbrella for all those multiple titles. And what the complication has been is that employers, uh, we can't dictate to employers what the job titles for their individuals can be. But what we can, and when we look at the work that the individualized work that that person is doing, like are they connecting, and this is part of what the labor department did as well, are they serving as um, are they linking people to services, are they connecting them to resources, do they have these certain qualities while doing that work, determines whether or not a job classification fits under the CHW umbrella. And so we try to, encourage employees and others to not get so tied up, Greg, on the title, but to look at the actual work of an individual. What are they doing? Are they, are they hurting? Are they helping these same populations, these diverse populations that we've been talking about all day? Are they out in the community conducting health education? It's just a whole list of uh, responsibilities and areas on which a CHW work. And that's usually how we, determine whether an individual meets the criteria for the title of community health worker. And I hope that helps.
Yeah, that's helpful. Okay, I don't see any other questions, although I do see that Kamia commented that one of the initiatives that Merlene talked about was one that she created or was sponsored when you were in the state legislature, Kamia?
Yes, actually, I created it, I drafted it and sponsored it.
Wow.
And that was the putting a health equity liaison in each of the 67 counties here in the state of Florida.
Oh,
Okay.
very nice. Thank
Fantastic.
you.
Real significant impact there. That's fantastic. Well, thank you, everybody. Thank you for our three panelists. Lots of great information. Really appreciate it. If you can please take a few minutes to complete the session evaluation, we'd appreciate that. And then the next session will be starting at 12:45. So another 15 minutes or so. And that's going to be sort of our wrap up. That will be our wrap up session for the day. And we'll have an opportunity to do some small group discussions. So thank you again. We'll see you shortly.
Thank you.
Take care. Okay, thank you, Kamia and Lisa. It looks like Merlene maybe has already moved on, but appreciate it.
Of-
Great session. Really
Thank you.
Thank you for having us.
take care.